Hello, everyone, and welcome to the Ministron podcast, where strength meets science. I am your co-host, Roy Jeffery.
I'm Linda Marraccini, a family physician, and I am pleased to have as our guest with Roy Jeffery, Isabel Suarez, a certified personal trainer and certified nutritionist. She has been driven by a lifelong commitment to health and wellness, and I'm going to have to read off of my notes just to make sure I cover everything. Isabel has accrued expertise in dietary counseling, weight management, sports nutrition, and prevention of chronic disease. She has also obtained additional training in hormones and performance, very germane to our conversation today. She collaborates with clients and healthcare professionals towards optimal health outcomes, as well as educational materials. Not to mention, she is in our audience demographic. In this episode, we are eager to have Isabel address a number of the questions and concerns that we've heard from you over the past few months in our chats on our podcasts. Isabel, please say a few words, and then Roy's going to take it away with a question or two.
Thank you for having me. Roy, thank you for also having me. I'm very pleased to be here and give you feedback on what I possibly can for you. And let's get this show on the road.
Okay, so as you already know, I'm a fitness professional as well, personal trainer. I own a personal training studio here in South Miami on Commerce Lane, Just Fit Miami Personal Training Studio. And I have a number amount of clients that are going through perimenopause and menopause, which was my focus to start learning more about it and getting involved in it. And you know, I hear the same questions all the time where I have to do research. But as you know, as a personal trainer, one of the biggest elements that are always missing is the nutritional part. And we know that's a big percentage when it comes to health, when it comes to weight loss or whatever it is. And that's usually, people know that, but they usually kind of take that out of the equation. One of my questions that I like to ask that I usually get is that why does weight become harder to lose during perimenopause and menopause, even when dieting and exercise haven't really changed?
Well, I'm going to address that for you. First of all, it's not only just pre and menopause, we also have andropause for the men. The men also go through this. And the reason that we have this, where your weight fluctuates and you can't either bring it up or it comes down and you start losing your muscle mass, our hormones go into effect in this. And as we age, depending on what stage you start, the premenopause, the postmenopause, and then the andropause for the men, that depicts where we are going to be as far as, you know, this is the reason why I'm not losing weight. I have subcutaneous fat. Everything is storing no matter what I do, what I run. That's where the food also comes in. You know, you need a full blood panel done to see where your hormones are at. Once you establish that by your healthcare provider, I take that along with the way that you're eating, see what your caloric intake is, and then to see what also you're burning and what your workout consists of. How many times a week are you working out? Are you actually doing enough cardio? Women need to amp up cardio because the older we get, our body actually shuts down. And I'm talking about your metabolism. We slow down. Mm-hmm. So if you think sitting in a chair at work for 10 hours, 8 hours, and then, I'll finish this in 5 minutes. No, you need to get up. You need to walk around. Mm-hmm. So we can address those in more detail as we're going through this podcast today.
Great.
My question is, the general needs, you know, for menopause and perimenopause, how that's different than the, younger age population, as far as, do you think is a more protein needs or protein to fat ratio? Also, we have, women that, of course, have bone loss, osteopenia, and osteoporosis. So is there differences in the needs? And, of course, if they're not exercising enough, maybe they're eating too much protein, or the ratio isn't good enough for what they're doing. They're out eating their exercise. What do you think about that, or what can you offer?
Speaking of experience from that, for the osteopenia, I do have that. So I do take care of myself even more so. So women tend to, let's say you're 37 years old and you're walking on this cliff. One day, you just straight fall off that cliff. That's your hormones telling you we're in distress. The body's changing. And you think, oh my God, I can't sleep. I'm having this night sweat. What is it? Maybe it was something I ate, because a lot of people think, oh, I ate steak and I'm having the meat sweats. And it's really not the meat sweats. When clients call me, they say, I think maybe I'm in premenopause. And my first question is, do you still have your period? When was the last time you had blood work? Have you spoken to your physician? Are you exercising regularly? Are you drinking enough fluids? And they're like, oh no, I haven't done any of that. I said, well, step number one again. Did you get a bone scan done this year? That's important, especially if you start premenopause at an early stage. Women can start as early in their 20s, depending on the person. And some women even start later in life in their 50s, where you actually start to hit menopause. And the same for men. Men don't realize that. They make fun of women all the time. Oh, because you're in menopause. No. Again, we're going to go back to that, because men also can lose bone loss, and osteoporosis happens to them as well. So working out and doing weights is really important, because that's how we break bone and we create bone on top of the supplements that you have to supplement with that, so that you can actually have it recreate. And again, you have to work out, you have to watch what you eat and what we put in our mouth. Yes, protein is a big factor, because that's for the muscle, but for the bone itself, you have to feed it leafy greens, other additional supplements, again, based on your blood work, what your results are. And I always recommend that an initial client that comes to me, I will recommend for the first year to do blood work every 3 months until you're fine-tuning what you're doing. This is not a temporary thing. This is a lifestyle change. Very much lifestyle. People say, oh, I'm dieting. No, it's not a diet. It's a way of eating, a way of making yourself healthy for the rest of your life. You're not going to look like a Barbie doll if your body is not that constitution, because I have clients that say, I want to look like that girl. I want to be able to wear that. No, you're a big bone girl. And the realistic figure you're going to be, look at your parents. If you don't work out, you're never going to be that thin. Realistically, it's taking care of your health and your general body in total. This is not, we're based on like social media appearances like most young people. And that's why I said, when you're going through menopause, women look great now in their 50s. Why? Because we're cutting out all the important garbage out of our food, processed sugars, fats, which we need good fats. People forget we need good fats for our brain as well. Very important to have the great fats. Ghee is something I always recommend. It's it's fantastic for you. You can put that in your coffee, and you would think, I'm having coffee with milk and sugar. These are beneficial when we're talking about increasing, for bones and loss in actual muscle loss. When we go back to that.
That's one of the things, a couple of things that you said, like, for example, when I have clients, and I have 2 instances just happened this past week that covers something that you said, but I basically tell them, listen, drive the car, follow the GPS, and you'll reach your destination. And a lot of them, they don't want to do that, or that's too much work, because you have the same body. There's just changes to it, right? And you have to adjust to those changes. You can't eat the same. You can't have a lackadaisical type of workout. Like you said, you have to put in the work. I've had this, like I said, these 2 weeks, I've had a client come to me. She was a new client because I do menopausal type training and education with clients, and she came to me specifically for that because she was going through menopause, and these things are that you're mentioning is what she brought to me, which is one of my follow-up questions. She's talking about the weight gain. She's talking about not having the energy, and then one of my other clients, she was just, I don't know, I just don't have any energy lately. I don't know if I need to go to the doctor, see what's going on with me, and I, you know how old you are, right? And you know what you could possibly be going through. And she's like, really? You really think so? You really think so? I said, I've been talking to quite a few people, doctors and people like yourself, and to be able to pass that on to them. So that is important. Like you said, find out what's going on with you. That's important. Getting your blood work, seeing your practitioner. And if they're not helping you through it, find one that will.
Absolutely correct. That is correct, and very necessary to do so. Yes, you did say that she doesn't have the energy. She probably has a low level estrogen. Her progesterones are probably low. Needs to get tested. And then also, besides getting those implemented and starting on that regimen, like I said, again, it's fine-tuning everything. And then motivational. You got to get them there. Depression, anxiety is all part of the menopause. For women, we freak out. We will drown in a quarter glass of water or this whole bottle over the smallest thing because we're going through menopause and we don't understand it. Nobody's ever really talks about that. And men, in the same token, they do lose their patience, not realizing that either their testosterone level are really low, they have no energy, they have fatigue. A lot of people have underlying disorders or health issues that also contribute to those factors, which has to be taken into effect when you're doing the blood work and we're working towards making them healthier and helping them with the same issues that they have along with the team of their doctors so that we can implement more things to increase the energy levels again and get them to that point where they need to be.
Absolutely.
So another question comes up all the time, and we've talked about it, which is what type of diet, or let's say we're not going to call it diet, it's a modification of your lifestyle, which is they talk about intermittent fasting or regular meals. What do you support? Or, they've said, the literature said they all work, but again, we have to talk about types of calories. So how do you guide people in that?
First, I talk to the client. I get a feedback from them. I sit down and have a one-to-one talk with them. Not only do I have them fill out a form because I want to know, give me your 7-day regimen of when you start eating, what are you eating? Is it out of a box? Is it out of a can? Is it processed? Is it frozen? Are you eating sweets? Are you craving salt? I need a full detailed list for 7 days. Those 24 hours, whether you're eating for 8, you're eating for 6, I need that in detail. That is going to depict on what's happening. And I don't ever call it dieting because dieting is something that it's a short-term effect for people that you want to diet. You're looking for long-term health, beneficial effects for yourself, for your body, your heart, your liver. You want to be able to maintain that status. So when somebody says, I need a diet, I have to lose all this weight, it's like, it's not a diet. Once I know what you're eating, how you're eating it, when you're eating it, what time are you having your carbs, what type of carbs, are they simple, are they complex? Are you eating a banana that's green? Is it yellow? Does it have brown dots on it? Do you know that's converted to fructose? The bad sugar, we have insulin spikes because you're not eating enough, you're stretching out. Oh, I'm fasting. Okay, that's great. It may work for you for the first several months. You're going to hit a plateau because the body's going to be, oh, yes, we do this all the time. I'm ready for this. You have to break the monotony when you're doing intermittent fasting. It may work temporarily and quickly to drop weight.
Right.
But that's why I said you have to have other alternatives for the client to be able to invest in better forms. Like I always said, it's a way of eating for life, not a diet, a healthy way.
Absolutely. Well, which is the difference between doing cookie cutter type diets because everyone is different. Which is to your point, I get that question all the time. Do you write diets? I was like, no, I rehab eating habits. That's what I do.
I like it.
We put aside all the, the other things that you're trying to do. We find out what you're eating. We find out what you should. Everybody knows that you shouldn't be eating for the most part. And then when you say diet, this thing comes up like this great fear because that's a negative feel to when you say a diet restriction, but it's just rehabbing for me how I look at it, and that's very important. I'm learning your approach to it, which is very unique as opposed to what I have learned.
Oh, it's very specific.
Yeah, absolutely.
Well, when it's not working, let's face it. If somebody's very successful and it's one of those that ain't broke, but there's obviously a lot of people that are not very successful in doing what they're doing. No, they really need help.
Very true. Very true.
I have another question here, which goes on with the first question I asked, and it's how much midsection weight gain is hormonal versus behavior or lifestyle related?
Depends. It's, again, individually on every person that you have as a client that comes to you, it's on an individual basis because that person may lack one other hormone that another one doesn't have, may have an underlying health issue that we're not aware of, can have diabetes. There's different factors that play into that role. But on an average, when you lose hormones, it's about 1.5 pounds of fat, subcutaneous fat, that we can accumulate and accrue in our body in the midsection per year. Especially if you're not an active person. A lot of people say, oh, yeah, I walked around the block. How long? Oh, for 5 minutes. Or I took the dog out to the corner and back.
Famous one.
The famous one. And I always say, you need to do that 45-minute brisk walk. Take the dog, take your friend, take the neighbor, go out for the brisk walk. Don't just stroll, walk. It's a fast walk. If you can't run and you have impairments or you have, prior injuries to knees or hips, really important, like that's your warm-up. You go out and you do that every day religiously for 7 days, and I guarantee you that those little simple cravings you get, they won't come because you're burning that energy. And you need to burn energy in order to want to eat, because there's people that are eaters just to eat to console themselves when they're feeling down.
Right.
So you have that type of person, they come to me and they'll say, oh my God, I put on 15 pounds over the holidays. I couldn't help myself. The pumpkin pie threw itself at me. And I was like, well, you could have had the pumpkin pie, made it natural with a real pumpkin and use an alternative, not sugar in it, maybe a real based molasses, a honey. I would tell people, read your honeys as well, because when you go to the store and you see that, you think, oh, I'm buying a grade A. No, Google it while you're standing there on your phone and you'll see what you're actually buying when you're in the store. And that's important, that sugar intake will kill us.
Yeah, you say holidays, it's just we're social beings. Going to these holiday parties that come up and things like that makes it difficult, and that's fair, being that we're gonna try to save up for the holidays and then eat and say, oh, I got to go back on another diet or what have you. But it's just the approach, like what you're saying, the approach to it, and a lot of times it's like just saying no. I don't owe my taste buds anything, but I'll indulge when I want to or whatever, but I don't owe it like I just had to, But what is important, like you're saying, with the hormones and some estrogen levels are too low and they're accumulating this fat. That's the one I hear all the time. They always grab their belly and say, if I could just get rid of this, right? And so I tell them you didn't get it overnight, so it's not going to go away overnight. It takes work, it takes commitment, and as well as nutrition. And when Dr. Linda was saying it was a good idea to bring you in, I thought this is a very important for our listeners to know, and even for us to know as well.
Oh, and I'll tell you personally that, again, the reason I got into this, besides that I was an athlete and it was part of my upbringing with all the professionals that I dealt with and were afforded to me during the years that I was an athlete, I realized in my early 30s, I said, oh my God, I think I'm going into menopause. And everybody thought I was crazy. And I'm like, no, seriously. I would go like this and my hair would fall out. And I would be like, all right. So I started to do food modification in my house. One day I just walked in and threw everything out, and the kids were like, what are you doing? And I said, no sodas, no cans. I went to the refrigerator, nothing frozen, nothing processed, and lifestyle changed. Everything was juiced in the house. Everything was purchased. I know it's terrible to have to go, and it's an inconvenience to go to the store every day, but that is the important part, because that's what you're eating. You're putting in your body. It's like you're going to buy a Ferrari, but you're going to put the cheapest gas in it. You're going to get what you get out of that Ferrari, So if you want to maintain that Honda with great gas and you want to be able to drive it for a long time, you're going to put the best care into it. So think of yourself as that vehicle or that beautiful purse that you love, that you want to polish all the time and carry with you and say, I paid $1,500 for this purse, but that's what you have to think of yourself moving forward, because your health is not replaceable by anything else other than your own care and the team you put into it. Your doctor, your trainer, your nutritionist, we are the team that will put you together, but you have to make the effort.
Absolutely.
And then and as you're intertwined in all that is, so the hormones, as you mentioned, anything 30s, even 20s. And anytime there's a change in hormones, you can see all of this. So pregnancy, postpartum, you'll see the changes in hormones. You'll go through all those same things. After having a baby, your hair falls out, all those type of things. So that's some dramatic things, even though we haven't been specifically addressing women after having babies, but a lot of that happens. It's very drastic and very, it's really debilitating for women. So anytime there's a change in hormones, you can see all these things, whether there's surges in hormones of pregnancy, there's a decrease in hormones postpartum. So and all the mood swings and all those types of things. So everybody knows that happens. That with But everybody knows the woman just had the baby and she's got postpartum depression or mood swings. So we see any of this in any hormonal change, men's changes, etc. Then back to the conversation we had about our about the exercise. Roy and I are constantly with the purposeful exercise. My patients go, oh yeah, I go out walking and I swing these weights. They're going to get selective hypertrophy of their biceps, and they're not working out any part of the muscle groups of the shoulder girdle, that type of thing. Right. And yet we have the converse. We say, we set the bar low. We say, just get out there and do something, because we try to get them to do something, just to get them moving. And I usually tell them the same thing. Put your dog up, take the dog for the walk, but put your dog away and then go out and do your walk. Just the dog got you warmed up.
Right, exactly.
So this is all part and parcel. And if you're going to go out for drinks or whatever, get some exercise before you go out.
No. Absolutely. Or put the drink on the other side of the counter. Reach over this way. Reach over to the opposite side. Yeah. You do a little exercise. And did you hear the great news from the government, the FDA, with the HR team?
I put an email out about it today.
I think that's fantastic.
Well, I've been doing hormones forever, so I didn't buy the whole thing. And it's very interesting data, because they put the same data about estrogen for vaginal estrogen as systemic hormones. And then there's differences between micronized progesterone, for example, as a sidebar of this, micronized progesterone, versus more synthetic forms. So yes, they finally, and interesting in this in this particular administration that came out, but so that's been revisited. So what I wrote in the email, I sent an email to my patients today about that, where I said, what we have not established is what age is okay to begin hormone replacement if you never were on hormone replacement. It's been conventionally said for the people who believed in hormone replacement that you should start in the first 10 years, perimenopausally for the best results and safety-wise. And for those of us who have always believed in it, thought to be the lesser of the evils, it's more beneficial than risk. And a person very close to me, breast cancer surgeon, they said, even the surgeons, and a couple have been on the news recently, said the data is out about breast cancer. There is no statistical significance to breast cancer with hormones. Mm-hmm. And for years we've known even a breast cancer develops on hormones is actually easier to treat with the hormone receptor positive. So it's better for bones, brain function, mood, of course. Mm-hmm. My belief is I'm not treating to the point of getting rid of symptoms. It's the minimum amount that does the job to prevent everything with regard to your bones and everything else, brain function. But for symptoms, I don't always keep increasing the doses, depending. It's an individual thing.
Right.
Mm-hmm. And I believe in a complete hormone prescription. That includes estrogen, progesterone, testosterone. Mm-hmm. And again, you have to weigh people's risk factors. You have somebody who has a clotting disorder, you have to look into that.
Right.
But yeah, finally, I'm surprised. I can't believe the stodgy old FDA. It must have been such data that the FDA finally, fell over on itself. Mm-hmm. Or all of them had wives that needed hormone replaplement.
Yeah.
Oh, probably. And then the men themselves needed the hormone for the andropause.
They've been given the damn testosterone.
Of course.
They've been getting their testosterone. It's that the women couldn't get it. The guys have always been getting the erection pills and all that stuff, but
Hey.
Come on now, boy.
Well, women need it too.
No, there's been a moving force. What is it? It's been the public demand. Women have become so vocal, and there is a lot of talk in the menopause world. It's been very vocal.
So is it safe to say that, being that is good news and is possible, is still have to take it on the individual case by case, because
like all this,
like for example, when people were taking the weight loss drug, and it was not, and it was just, but it's something that
we're going there next.
You just dive into it, as opposed to like you don't need this or as much or what have you. So I'm thinking the hormone therapy. So I guess to put it out there that you don't just go in there and drink a whole bottle of water here. You take what you need. And that comes from having a team of people, starting with your healthcare provider.
Right.
Right?
But we really need to talk about the GLP-1 class medicines.
All right, let's dive in. Let's get into it.
Thank you. You're giving us that foray into it.
I don't want to say the name of those, but they're terrible.
Well, the problem is they're all online. Everybody's getting them. People that I personally don't feel should get them. I know everybody wants to microdose them. That's all I hear. Can I microdose it? Good luck with calling them into the pharmacy microdosing them, because that is almost impossible. You can get them online and do whatever you want. You can get them from the pharmacy. It doesn't qualify for your insurance to pay for them for most of these dosings.
Mm-hmm.
So, Isabel, please tell us.
Oh, I can definitely tell you about that. So I have clients that call me all the time now with the GPO ones that they're doing this. Oh my God, I'm losing all this muscle mass. What do I do?
The muscle mass, please.
The muscle mass. We call it the Ozempic, and I hate to say that.
Ozempic ass.
You lose your ass, you lose your muscle, and they're freaking out. First of all, that drug was made for people that are diabetic. So if you're not a diabetic, it's great. And I told them it's great to lose weight. There's other ways to do it before you go here. I understand if maybe it's a health risk and you have to address it very quickly to lose weight in that fashion. Yes, you can go ahead and do that. I have clients that, like she said, went online to these doctors on Instagram and just signed up without knowing their real background of their health. And they're taking this medication and they're freaking out because of the same thing. Well, what do? I've lost muscle. Well, how long do you plan to stay on this thing? Are you going to wean yourself off? Because when you come off and you're not diabetic, you're going to put that weight back on and you're going to get that same...
Like 90% of people put the weight back on.
Back on, but you're still going to not have that muscle in your tush or in your quads. So they're like, what do we do? I said, well, increase number one, protein. Start weaning yourself off that thing. Increase your cardio. Let's increase leafy greens. Let's increase other supplements that can increase your muscle mass as well, because you're not diabetic. I'm a pre-diabetic myself, and I take care of myself extra careful because I don't want to be on this drug. The less drugs we take on our body that we don't have to, the more productive your own immune system is going to react to it, your metabolism. But this, it's a breakdown completely. Like I said, if they're not eating enough protein, depending on how much muscle loss they have, and again, it's on an individual basis, because you can't tell the person, hey, you need to eat 20 grams of protein without diagnosing them, measuring the body fat, measuring what muscle they have, what their BMI is, and not addressing that with them. Because, like I said, a lot of the girls that have beautiful bodies now are like, I'm too thin. What do I do?
Right.
Get off that. Number
They're
one.
fat thin.
Yeah.
They're not shapely thin. Their muscles don't look good.
No, they've lost like the shape of the thighs. You lose your quads. Yeah. I'm not sure if any of your clients.
But yeah. And that's the thing. People realize if you lose, let's just say weight as a whole, you're going to lose fat, but you're also going to lose muscle. It's just going to happen.
It is.
And especially if you're not working out, particularly in a intensity level to where it's inducing muscle mass, muscle gain, it's just not going to happen. And it's just going to be going the opposite way when it comes to muscle mass. And you might lose the weight, but still be a little soft, because of...
More than soft. I've seen flaccid, the skin actually.
Yeah. So losing weight too fast causes that very, very a lot. Even before this, when people would just go on these really strict diets and they would lose weight faster than what was safe, they would have...
Yeah, we would need a caloric deficit depending on what your intake is of your food, and what your output is for exercise in the simplest way for those people that are not familiar with this. And then we can do a caloric deficit, meaning if you're burning 1,500 calories, are you going to eat 1,500 or you're going to eat, if you're burning at 1,500 and you're going to eat 2,000 in calorie, we need to see what your balance is and what your long-term or short-term goal is to lose that weight. But if you're going to do this type of medication, I suggest you see your physician before you start this. Don't do it online, people. It's not like the healthiest thing.
Well, as you and I discussed, I really feel, very concerned about pancreatic enzymes going up. And I see a trend in that. Not everybody, but nobody's monitoring that. And I suggest that people at least get that monitored, because once you inflame your pancreas, that's a lifelong problem, and you can really permanently damage your pancreas. The other thing is, I think your expertise is valuable in many things, but I think it's really valuable right now with all these people doing this, that they need a program. The other thing with these medications is that people have no desire to do anything. They don't want to eat. They don't want to do anything. Half of them don't want to go out. Half of them are really sleepy on the medications. That creates a lot of fatigue. And to get motivation to even get them to eat properly is amazing. I mean, just amazing. So they really need to be totally whipped as far as structure. That's a huge problem. They don't. I mean, we all know it cuts cravings for gambling, for many other things, alcohol, which is good, but they don't eat right. They have no desire to eat. They eat such a pittance of food.
Well,
this is where I really think we need a dietitian and nutritionist.
Other stuff, like I'm taking whatever anyway, so I cheat.
That's where these programs, I really fault these pharmaceutical companies, and this especially, some of them I hear the online programs have some guidance online, but I have bitched out, pardon my French, but these companies that they have not even the simplest little weight management, dietary counseling, caloric chart, anything for people. This is where somebody like you is invaluable. Not all your other things, of course, but this is such a critical problem.
They don't even
realize
that they'll have bowel issues. Severe bowel issues. We know the pancreas and the insulin.
Oh, the bowel stuff.
The bowel with that. There's people that have
constipation.
No. Some even have the opposite. Obstruction. They have diarrhea. Absolutely, or severe vomiting, uncontrollable. Because they're not diabetic. So you said the pancreas is made to process the insulin,
right?
And they're not there. Like I said, so if we can do a great team of putting them together, whoever is interested, they can reach out and
Absolutely.
Maybe, Isabel, you could mention creatine. We talked about creatine.
Well, let's talk about supplements as a whole. We talk about supplements to support my research.
Creatine is a great beneficial
because everybody else.
It's great for you, but it can also be bad for you. It's great because it gives you energy. It helps you build your muscles. A lot of people that have kidney problems shouldn't even be on this because it also affects kidney dysfunction, basically. So if you don't drink a lot of fluids, that's very necessary, but it is a great thing. Like I said, I take it. I don't take it every day. And everything is specific, again, to the individual person, how they're structured, what their type of workouts are. That's how I recommend the supplements that I do, including the creatine as well.
Is that like after you work out with your protein?
After I work out. Actually, I put mine in water, and I drink it in water instead of in the protein because you're already taking in a massive protein with the creatine. So you're going to overload your kidneys between protein. Your PKUs can be affected with this when you're drinking too much proteins, and you get your kidneys will shut down.
And the water aspect, as you said, you need to drink more water. And when you say more than what you're already drinking, if you're already not drinking enough water, you're in trouble. But if you're drinking water, say, I already drink a certain amount of water. Okay, now you're taking creatine. You need to up that.
Which is already a problem with people that drink.
Right. I always tell them, if you're going to drink the creatine, put it in a water base, all water, drink it 8 ounces and follow with another 8. And then you can go home and maybe an hour later have your protein shake and then a meal.
Right.
I'd rather you have the protein out of a piece of chicken, piece of fish, so that you can avoid that issue of it happening. Because a lot of people would think, oh no, I just can add everything together without knowing. And that's important that you don't mix all of these items together.
I think we're going to have another whole nutrition.
Yeah, absolutely. I mean, because it's a lot involved.
Yeah. Especially, sorry, not to interrupt you, but in the hormone part, we didn't even touch the part of caffeine and alcohol, which increases the hot flashes for women. It disrupts our sleep. It will make us anxious.
Say that again, please. Say that again, because we are in Miami, which is the coffee town, the alcohol town.
I am a coffeeholic, and I'm into it.
Right.
My coffee's in the morning, but you need to cut the caffeine. And if you don't really work out, you shouldn't be taking in a huge intake of caffeine to begin with, because in andropause, menopause, and being menopausal altogether increases your hot flashes, your anxiety, it interrupts the sleep again, like I said, and alcohol as well. You can go to, instead of drinking beer, which I love beer, go to a vodka, go to something that's distilled 6 times which is cleaner for you if you really want to have a drink. You know, I'm not saying stop everything because life is normal and the weekend treat yourself to whatever you want, but you know that the beer and hard liquors do take a toll on the body for women and men when you cannot sleep. Trust me, I used to be that person that I would wake up at 2 a.m. and be like,
yeah. So consider timing when you do.
Yeah.
Timing when you do.
Timing when you do.
If you're going to have a drink, don't have it and then go to sleep on your drink.
Absolutely.
Maybe hours before, give it time.
Consume. So
Right.
for that one drink you have, 2 full bottles of water. And not to just chug them down, pace yourself. But for every one drink, I always say it's 2 of water because you want to flush that out of your system as quickly as possible.
I usually tell people to, you know, preface the drinks and coffee with water.
Right.
Even the morning, especially. Yeah, they want that morning coffee.
Yeah, that's important. There's some other things.
The ghee is like you think you're drinking milk and sugar in there, and it's not.
Right, and we're going to talk about it. I got to get that from you, too. So with that said, we're going to get ready to close, and we want you to close with some closing remarks in terms of what you would like people to know about what you do personally and about nutrition as a whole.
Okay. So basically, if you're in premenopause or postmenopause and andropause for the men out there, you can reach out to me and I'll give you a detailed prescription, as I would say, to your health and helping you improve. And in general, if you find yourself there, you need to see your physician, go get blood work done, a full panel, also have your thyroid checked, put a list together of what your underlying issues are so that can also be addressed with your physician if you haven't seen. And also with the person, your CPT, if you have your personal trainer or your team that puts you together, reach out to them. Let everybody know where you're at, what you need and what you're looking for. And if you need help, reach out as well. And I'll be happy to help. It's what I love to do. It's my passion.
So she puts together a plan, right? A plan. And that is very important for us who go through life being great planners, whether it's financial, vacation, or whatever. You get a plan together and you reach for your goals to accomplish increasing your quality of life or going through what you're going to have to go through, perimenopause, menopause, andropause, whatever. But you have to go through it, and why not go through it with a plan instead of suffering? I don't know if you ever seen the video of the woman that was outside and her scalp was like smoking from her hot flashes, and she was outside, and you know, just things like that. You have to have a plan to be able to go through this, to go through these new things that your body is experiencing. And of course, I always say this. People say, "Well, who are you? How would you know?" You know, but I'm around women all the time, and I learn these things through experiencing, through speaking. I learned a great deal of things from Dr. Marraccini, and this was even before I got interested in menopause. I always speak to her about things or when I meet new clients. So don't be afraid to ask questions. Don't be afraid to reach out to Isabel or to Dr. Marraccini or myself. And we do this podcast very frequently. We have followers. We always ask people to follow us and learn and to help us to address whatever questions or anybody that you may think or may help with what you're experiencing out there. But yeah, we really appreciate you joining us, and we want to thank you very much for your time, for coming out and spending with us. We want to thank Community News Network for having us and hosting us in this beautiful studio. And until next time, I like to say this is Roy Jeffery, fitness professional, owner of Jeff Fit Miami Personal Training Studio.
Linda Marraccini, and make no bones about it, has all been Roy's baby. This has all been his idea. So kudos to Roy. But thank you very much, and to Community News.
Thank you.
Thank you.